At least two different schools of thought have developed over how to calculate coronavirus data, specifically the daily positive rate. Early on in the pandemic, Governor Doug Burgum cited this percentage as the number to follow because it does not go up or down based on the number of tests completed, which varies from day to day. But a highly cited research university tracks North Dakota's daily positive rate differently than North Dakota's own Department of Health. Renee Cooper reports in tonight's top story.
Many of you who have been tracking global COVID-19 case numbers will likely recognize this map. It's from Johns Hopkins University.
Which, of course, is a well-respected brand in medicine, that they're using the data from a group called the COVID Tracking Project. The COVID Tracking Project is sponsored by a magazine, The Atlantic. This is not a government-sourced thing, so that causes me some concern.
The COVID Tracking Project is a volunteer organization. The sole mission, to collect and publish coronavirus data for the U.S. using information collected from states. A team at Johns Hopkins does its own calculations using this data, and the project has become a primary source for national news sources too, including NPR and CNN. So what's the discrepancy?
The state gives out two different numbers each day. This one shows the total number of tests completed the day before, which includes people who have been retested, whether it was months ago or twice in a week, a common practice to ensure the test didn't give a false negative or positive. The second number is total unique individuals from the day before, meaning only people who were tested for the first time. So, to get a percentage of people who tested positive out of a day's worth of testing, you can use the total or the unique total.
The North Dakota Department of Health uses total tests. Johns Hopkins uses unique, and the result is drastically different. The Department of Health declined an interview request, but we were able to get some answers from the governor at his weekly press conferences.
It doesn't matter if we tested them last May. If they thought they had symptoms last May and got tested and they were negative, turned out they had a cold, they walk in the door and they get tested today and they're positive, then what, we can't count them?
But that doesn't account for the multiple tests one person is often given in a week to 10-day period. In a statement, Johns Hopkins University says, quote, currently states may not be distinguishing overall tests administered from the number of individuals who have been tested. This is an important limitation to the data that's available to track testing in the U.S., and states should work to address it.
We're doing it both ways. When you look at the footnote under Johns Hopkins, it says that states should report the number of individuals that are tested and the number of total tests. And we've been doing that for all along.
It's true. Just like I did for this story, you can easily calculate the positivity rate using unique tests from what's provided. And at the end of the day, consistency is key in reporting. And no matter which calculation makes more sense to you, the rate of people testing positive each day in North Dakota has been consistently on the rise all month. Reporting for KX News in Bismarck, Renee Cooper.
And Governor Doug Burgum added he's noticed some errors in the COVID Tracking Project's data from North Dakota that he's working to address with the source. Which brings us now to the latest